Hey, and welcome to the Catholic Family Podcast. I'm Ina Davis, and today we're talking about birth, pregnancy, and the postpartum period, and what we in our Western culture might or might not get wrong with it. And also what we wish we had known before giving birth and what we think could help others. Um, just to remember, these are purely our opinions from our own experience, and it's not intended to put others down. Our intention is to share our knowledge and to help others with things we wish we would have known. Also, short disclaimer: since this is talking about birth and pregnancy, there may be some material that's not suitable for children and possibly men either. So yeah, I'm sitting on this birth ball, so I'm kind of bouncing a little bit, like just automatically, if anyone is wondering, because I'm only like 4 days away from my due date myself. Um, and my guests today are Michelle, who has 4 little kids under 6, and another one on the way, and Brenda, who has 2 little kids and giving birth naturally twice. And Suzanne, who's our expert today. And I'm going to give it right to Suzanne right now, and so she can tell you a little bit, why she's our expert and what her occupation is.
Hey, well, I feel like I should say that the real experts are probably the moms themselves. But I have studied naturopathy, so I'm a naturopath, and I specialize in pregnancy and postpartum. And that kind of became my passion after I had my own kid. So I've got kids and one on the way, but early stages yet. So I don't know. Birth is just like super fascinating to me, and there's just so much that you can learn about it. And I think it kind of stemmed from because like I've always been afraid of birth. It's always been like my biggest fear before I actually gave birth. And so when I was pregnant with my first, I was reading up on all the material, everything that I could to make sure that I had the best experience possible. And then when I actually did give birth, it was amazing. Like, I know that probably sounds crazy, but I was like, oh my goodness, I want to do it again. So yeah, I think there is a lot that you can actually do because it's kind of ingrained in our culture to kind of see birth as like this really scary thing. But there is a lot that you can do to actually make it a really positive experience. So today I might hope to share a little bit about that and some of the ways that you can stay healthy in your pregnancy. Yeah. Is there anything else?
That sounds really great, yeah. And I'm especially going to be listening now. Like I said, I'm right before giving birth, and I know you'll also share some great advice about postpartum period. And are there any things, like, just to start off with, the first trimester of pregnancy and in the beginning, do you have any like prenatals you recommend, like that you really should intake, or is there anything that help with nausea and those kind of things?
I would actually say because going from like the angle of being a traditional Catholic, and we don't have, obviously we don't plan our babies, so I think say before you age, maybe around 3 to 6 months before you're planning to get married, I think it would be a good idea to kind of just focus on your health and to get some blood tests done, see if you have any deficiencies. And if you're really thorough and you have the money, which not everyone does, and I didn't, you can actually get a hair tissue mineral analysis test done, and that can kind of tell you whether you have any heavy metals present in your system. And you really want to get rid of if you have high levels of heavy metals, because that obviously gets transferred through the placenta to your baby and then breastfeeding. And like traditional Catholics, a lot of the time you kind of just go from pregnancy, breastfeeding. Like it's kind of like a little bit of a cycle, and you don't get the chance to kind of detoxify. So I think and planning that a little bit before you get married is probably a good idea. Like, it can't harm you at all. So yeah, that's something I would recommend. And with prenatals, definitely look for ideally something that's whole food based, because it's more easily absorbed. And some of the key nutrients that you want to avoid folic acid, because there's I don't know if you've heard of the MTHFR mutation, but a lot of the population now have that, which means that they can't properly absorb folic acid, and it kind of just builds up. So you want to look for something that has folinic acid or methylfolate, and that means that you're getting those nutrients and they're already methylated, so they're going to pass on easily through your baby and prevent like the spinal, the neural tube defects and things like that. I've got some notes because I'm not very good at speaking, but I've also said choline. Has anyone heard of that nutrient? I'm just curious.
No, I'm like taking notes too, so maybe talk really slow. No, I'm just kidding. I'm like, oh my goodness, this is great information. I need to know this stuff. But I haven't heard of it.
So this is something I don't know until like around the time that I had but choline is a very underrated nutrient. So important for the baby's developing brain and spinal cord. And studies have shown that supplementing in mums during pregnancy actually helps to improve like learning, memory, attention, and stress reactivity for the child in later life. So I think when the child was around 7 or something, and they found that in mums who had supplemented, their children had better cognitive functions and things like that. Another one definitely you should be looking at taking supplement is fatty acids. So things like your algae oil and oil. Again, super important for the baby's brain and their retina development. And 1/3 of the dry weight of the brain is made of DHA, which is a component of omega-3. So if the body isn't getting enough DHA through the diet, like if the mother isn't getting enough, it will actually steal from her brain to give it to the baby. So that's often why mums during pregnancy and postpartum kind of get that, that really foggy forgetfulness. That's part of it. And postnatally, it can prevent maternal depression. So you want to get good amounts of DHA. There's two. It's got EPA and DHA. So you want something that's got DHA around 500 milligrams, and make sure it's a good quality one, tested for mercury and heavy metals, because often it's with the fish and they kind of contain mercury, and then that can be in the fish oils. So you want to get one that's tested for that, and then discontinue 36 to 38. Just you don't want to be taking heavy amounts because it can increase bleeding after birth. So that's the only thing to note. And yeah, I think I'll stop there because
that sounds really great. Like, is there something that you recommend, like how you have to change your diet right before birth, let's say at 36 weeks or 38 weeks? Is there something, are you still trying to eat as you did before, or is there anything that makes for a smoother and easier labor?
the only thing that comes to mind straight away, which I think probably most women already know, is red raspberry leaf tea. So if you take that in the 3rd trimester, it actually tones the uterus and can help. Some studies have shown that it helps facilitate an easier delivery. So I don't know anyone who doesn't want that. So yeah, it's not everyone likes the taste of it, but you can make it into like an iced tea, or you can add some honey to it, or just make it nice if you can't stomach it.
That sounds good. I actually just got a package of that from the pharmacy, so I guess I just have to drink it. And I was wondering too, like if Brenda, Michelle, if you have anything, because like I just lately came across reading that you're supposed to eat dates. And I thought that was really funny. So that kind of stuck with me. And that they have all these properties to like, yeah, soften the cervix, and like they high in potassium. They're great for the anti-inflammatory. I actually took some notes too. They can help with your iron levels. So if you're really tired and stuff. And I guess there have been 2 Iranian studies, just beginning of the 21st century, where they looked at different women, and they showed that the women who consumed, I think, 5 to 6 dates a day, they had significantly easier labors. And yeah, I thought that was really funny. And I saw you nodding, Suzanne, so you probably heard of this too then.
Yeah, I remember that one. It's actually kind of hard to eat that amount. I don't know if anyone else struggles with that, but I was like trying like, well, how can I have more?
I made these like energy balls where you like cut in nuts and dates and several things, and they taste actually really good. And so I freeze them for nursing after, and I think I'm gonna take them for the birth. And also right now they just taste really good. Like I can share the recipe, but even my daughter likes
really
them.
Cool.
So.
My mom makes those. I think she calls them Magic Max balls. Like they look like the Princess Bride pills that he takes. But yeah, those are really good. And then I just want to add really quick. I know that this is like good in general, not just for pregnancy, but I know for me, like good dairy and good eggs has been really helpful. I just drink a ton of raw milk and like good farm eggs from farm chickens. And yeah, I know that that's supposed to help too. And I find that I crave dairy. So I'm like, I must be deficient in dairy. So yeah, it's helped for me, just a lot of real raw foods, I guess.
Yeah, get on the good stuff. Actually, it's interesting that you say that with the eggs, because eggs are one of the highest sources of choline. So maybe your body's craving that for a reason.
Oh, awesome.
I just want to say though, another way to get dates is Larabars, if you guys have ever heard of those. But they usually have, I don't know how many dates per Larabar, but they're actually really good. So that's how I kind of tried to get more dates. But I also wanted to ask, do you kind of tell people to keep track of their protein intake? That was like a really big thing the midwives wanted me to do, like when I went to the birthing center with my last kid. And I was just curious if you really recommend that or think that's necessary.
I would say you don't need to be too pedantic about it, but just making sure that you have good quality sources and you're getting enough throughout the day. It could be so you're too much if you don't want to have it in pregnancy. So protein, your blood sugar levels stabilize. That's always good.
Oh, gotcha. Also, I just
don't be too worried about it.
Well,
I
just want to say,
like you'll know. I think you'll know if you're getting.
Oh, okay, gotcha. But you should tell us exactly what all you did to have such an amazing birth, like, because I want to definitely take notes on that.
Me
Make
too.
sure at some point you let us know exactly what you did.
What's the secret?
Right.
I think it was the books that I read. Like I know Ina's got there is Ina May Gaskin's Guide to Childbirth. So that was a really, really good one.
Yeah, it's good too.
Oh, good. There was another one that I read. It was called Birth Skills by Juju Sundin. I think that's an Australian book, but basically it tells you about how you can kind of distract yourself in labor. So there's like different techniques that you can do. You can kind of do like these stomping things, or you can get these like little colored balls and like focus on like a color during a contraction, or you can kind of just do it's all about the mind and kind of like taking it away from the pain.
Okay. Is it kind of like hypnobirthing? Have you heard of that? Is it kind of like
actually, I don't know. Yeah, yeah. That one kind of like helps to take away the fear of birth a lot, help you with your breathing during birth. I've heard that for some women it's like thing, and then for other women they say that it kind of goes out of their head during labor. So I don't know.
Yeah.
So do you think the most important thing is, do you think distraction, or is it not being scared or relaxed? Because I know there's this mind-body connection. What would you say was for you personally the most helpful tip during labor and during the different stages?
For me, like during the early stages, I think I didn't need to distract myself too much. But definitely during like the later stages, like transition, I needed something else. I couldn't just breathe through it. Like I needed to do something active to kind of take away from the feeling of the contraction. So I think like depends on the stage of labor. That's just my experience though, but maybe someone else can say what they thought.
And Michelle, how was that for you? Because you had the most births of all of us. Were there some that were better than others? And if so, why?
So I would say my first was just the worst. She was 8 days late, and I ended up having and where they put you in inducement. They induced me. And then I just went really quick after a certain amount of time, and my body was not prepared, and it was all rushed, and I had an episiotomy, and it was terrible. And I mean, I'm not saying that it was because I was induced, but I think that might have had something to do with it. I just wasn't prepared. My body wasn't ready yet. And then my easiest by far was my third, Claudia. She was just so straightforward. She was, probably 5 or 6 hours, and I had a great nurse, and she was just super helpful. I think that's for me something that's really important, like knowing who is going to deliver your baby and having their support and liking them. My first two, I had male doctors, and I just wasn't comfortable with it. And I should have changed that, but I just didn't. I just stuck with it. And they just don't understand. I'm sorry. Like they aren't as supportive, and having that support, just like having someone to tell you, you can do this, you've got this, you're doing a great job. And if that's your husband, like that's great. And I was really looking into getting a doula this time around, which I might or might not still, but that I know people have said is really helpful too, just so that you have that kind of that cheerleader, like cheering you on. And it helps with your mental, abilities, because you're not in a good mindset most of the time. And just having that support, for me, that was really helpful. So that was like a big difference between Claudia and Daria, my hardest and my easiest, I would say. But I wanted to ask, have you guys used a doula, or have you thought about a doula for your births?
I would love to try that. Yes. I haven't, and I don't know anyone here, but I've read about it, and just the whole concept makes a lot of sense. Just how, when you're most comfortable and you feel most comfortable with the people around you, it just seems like women statistically have less interventions during birth. And I don't know. Have you, Suzanne or Brenda? Would you use a doula?
That was that's one thing I would.
Suzanne's on. You go first.
So yeah, I used one for my first. I think I had such a good birth. And then for my second, I got a student, so I had like the same person there for all my appointments and things. And then I think for this time around, I want to get a doula again, because they're really good.
That's awesome. Brenda?
Yeah, that is one thing I really wished I would do differently with the first, is get a doula, because I was like, oh, they're kind of expensive. Do I really need it? And yeah, I really wish I would have. Maybe next time.
Yes. Another thing I wanted to mention, yeah, because I feel like a doula is also it shows a certain way. Because I came across in this book also that you recommended, Suzanne, Gaskin, who's probably the most famous midwife alive right now, and she mentions these two models of maternity care. One is kind of the midwifery model of care, and then you have the techno-medical model. And the difference is, like, in the midwifery model of care, which not every midwife follows. Some of the midwives might still follow the techno-medical model. But in the midwifery model, the woman is kind of it's a female-centered model, and you kind of look at birth as being something healthy and something that the woman does. Whereas in the technical model, it's more like something passive that happens to the woman, and where medical intervention is necessary at every birth. Whereas at the female-centered form, it's also sometimes necessary. It recognizes that, but in general, the woman is perfectly capable of giving birth herself. And I also just recently learned that obstetrics, the term actually comes from Latin obstare, which means bystanding or watching, meaning that's what the care used to be, that the doctor or the midwife were actually just there to only intervene if there was a need. And this technical medical model is actually only 2 centuries old, so fairly new. And yeah, I was wondering too, if you've heard about that, or if you have anything to say about that, Suzanne.
Yeah, I think birth is starting to change better, because I know, like, back in my mum's example, like when she was giving birth, it was just kind of like viewed as like a medical thing, like you're saying. Whereas, like, women have been birthing for like hundreds of years, and it's a completely natural thing. So I think women have kind of lost confidence that they can actually deliver their babies naturally, and they kind of have been told that they need help, which, you know, they can do in certain circumstances, but I think it's kind of just become the norm. Like, I think the cesarean rate in the US is around 33% or something, and I think it's similar in Australia. So it kind of just shows you, you know, do you really think we need a third of the babies to be being like by C-section? I don't think that that's personally necessary. So it's just interesting. I think it's shifting back to kind of a lot of women now want to birth naturally. So that's a good thing.
Yeah, for sure. Have you observed the same thing, like Brenda and Michelle? Or?
I think that it's kind of typical with any medical field. They put you in a box, you know, when you're pregnant or when you're delivering. You have to fit inside this box, and if you go over a certain amount of hours, then you'll get a C-section, and if you are, you know, having this amount of pain, you get an epidural, and you really can't fit everyone into a box, which is why it's just important to let the mother be in control of her birth, because obviously she knows what's best for her body. And there's some exceptions, obviously, but having the mother take a more natural and, you know, take on the job that God has given her, like, that's definitely a better way to go than fitting everyone into this box and, you know, treating us kind of like we're just a sheep, you know, like, all right, here's another patient delivering a baby, and it's not unique, it's not special. They're just doing their job and staying on schedule, and, you know, just kind of typical with a lot of the medical field, I suppose.
Mm-hmm. Yeah.
So I actually had a really good experience with a hospital birth with my first. So I did like a birthing center in a hospital with like midwives and stuff. And this hospital, actually, I think they were like just starting to do water births even. So it seems like there are some hospitals that are starting to be more like open to like birthing in different ways, and instead of, just laying down on a bed and that's the way it goes. But so it's could be a good option too to find a hospital like that if you're, kind of worried about going straight to a birthing center or even a home birth, because it's kind of like a middle ground. But
Yeah, that sounds great. I actually wanted to do that for this pregnancy, but there's only one birth center and they're booked like months in advance. So you have to register there with a positive test, which kind of shows you how high the demand has gotten. So I feel it's like proving your point, Suzanne. Like it's the same here, that there's a little bit of a shift. People trying to give birth more naturally and more in control. But yeah, that sounds like a really good idea, I have to say too.
Right. That's actually what I'm doing this time around. So I'm at a birthing center kind of connected to a hospital, and I have had the best experience so far. Like the midwives are awesome and they're so hands off. They let you do everything on your own and you take all your own vitals, and it's just so nice. Like I just feel like it's less pressure, and they're just really, really understanding about what you want and how you want to give birth. And you can have a water birth if you want, and a lot of options that I never had with my previous 4. So I'm like, why didn't I start out with this? But yeah, you learn as you go.
That's awesome. And I know
That's
Suzanne,
literally what my situation was.
you go ahead.
Oh, sorry. I was say, yeah, I did the same center in a hospital. That's what I've had for my first 2. So yeah, another vote for that one.
Nice.
And you mentioned before, Suzanne, that you're like really passionate about the over medicalization of birth. Do you think, does that come from like things you read and personal experience, and how did that come to be?
Yeah, I think the books, I think that kind of highlighted that. And I just, yeah, I watched a documentary as well about birth, and it was talking about how women, a lot of women have birth trauma. Now, after their births, they just feel like they often have depression and anxiety and things like that as a result of the births that they've had, because they feel like they wasn't to, they feel like they did. And oftentimes women don't even know that they can actually decline any intervention during birth. So, if a wife or an obstetrician said, I'm just going to give you a cervical check or whatever, you don't have to say yes. You can say, no, I'm uncomfortable with that right now. So I think, yeah, for women to know that they can say no to anything, because that's their right when they give birth.
Yeah, that's so true. I feel like that's a really important point. And I think it's not always as easy as it sounds. Like I think you're always uncomfortable speaking up, or if a doctor tells you this is what you have to do or this is scientific, but it's not always that simple. And I know, for example, a friend of mine, she had like a gestational diabetes, so just the diabetes that you have during pregnancy. And we were really close to Austria. It's only a 5-minute car ride, and she was there. And in Austria, it's, for example, common, if you have that, the doctors will always give you insulin. And in Germany, the consensus is more that if you are not like overweight and everything, and it's clearly only like in the pregnancy, then they try to get control of it just with nutrition and exercise. And so she liked that better. And so she just drove over the border and had her baby in Germany this time. And I don't think that Germany by far is always more natural or anything. That's not the case. It was just in this one example. But it really shows you that even doctors disagree. And in the end, you I see them a little bit as health consultants, and it's still your decision. And it's not always that clear that this is the one common scientific point of view that you have to follow. And yeah. yeah, I feel
No,
I feel like
I've almost seen the same thing I'm going through with this pregnancy is the group beta strep. You know, if you get tested positive, you're supposed to be on antibiotics during birth. And there are like so many ways that you can treat group beta strep naturally, like with homeopathics or with diet or with garlic. Like there's a lot of natural ways to treat that instead of just going on antibiotics. I mean, I guess for some people, if they're more comfortable with that, like that's their decision. But for me, I'm like, I don't really want to start off my baby on antibiotics. And so just looking for other ways than the common like protocol is really important because you'll find that a lot of times there is something you can do that's natural, which is, yeah, a pretty cool thing.
hmm Actually, I've read too that this test, like if you do it 2 weeks later, it can be negative again, and that is really very situational and stuff. So it probably shouldn't
Right.
be discouraging or anything. I know, Suzanne, you've mentioned a healthy microbiome before. Do you have any like advice what we women should pay attention to or to avoid being
Oh yeah.
having to get antibiotics?
Yes, so GBS in my and second, but I declined the antibiotics, and I actually work microbiome in a better place. So something that can really help is taking a probiotic in the third trimester, and you really want to get something that has strain-specific probiotics, so something with a lactobacillus. Some of the good strains are Lactobacillus reuteri, Lactobacillus rhamnosus, and Lactobacillus crispatus. So they're the ones that are really, you kind of want to crowd bacteria by taking these. And that kind of also helps because when the baby comes through the birth canal, it's actually exposed to all your bacteria. So it's really important actually that you have a good microbiome when you give birth. And I actually just had an interesting statistic with antibiotics, and I don't want to scare anyone because sometimes, they're necessary, but one study found that children exposed to prenatal antibiotics in the second or third trimester had 84% higher risk of obesity compared with unexposed children, while C-section was associated with 46% higher risk of offspring developing childhood obesity. But I also want to say that a lot of damage can be done mitigated through breastfeeding. So don't despair if you've been given antibiotics.
I think we just froze. All right, it's working. Okay. Yeah, I feel like that's a really good point. And yeah, like you said, it's not to scare anyone, but it's also, you also see why you see maybe childbirth and pregnancy also shifting more naturally. There's also still a tendency where maybe some doctors will be really quick to suggest interventions like C-sections when they're not necessarily the only option or things like that. So it's good to educate yourself about that because I think oftentimes doctors will make decisions based on liability or ease or sometimes maybe even profit, unfortunately. So yeah, I think it's definitely good to remain your patient autonomy and to also keep in mind per se having a baby is a very natural and healthy process and you're not sick.
Right. And I think another thing that's kind of important with birth in general is like doing what's comfortable for you. Like, I looked into having a home birth this time around, and there were a lot of pros like to doing it, but I was just stressed out about the idea. And I have really bad laws here in Nebraska regarding home birth. And I was trying to jump through hoops, and my midwife that was going to deliver was about 3 hours away from me, and I have pretty quick labor and deliveries, and I was like, yeah, my husband's going to end up delivering this baby. And I wasn't comfortable with that. So I think eventually I want to warm up to the idea, and like I would like to have a home birth, because I've known a lot of women who have really great experiences. But this time around for me, I was like, this is stressing me out more than it should be. So yeah, I decided to go with the birthing center. But yeah, I think that's important too. Just don't feel pressured by what other people tell you, or what your parents did, or what your in-laws are doing. Just do what you want and what makes you comfortable. And if it's the hospital, like, that's okay. And if it's home, that's good. And if it's birthing center, that's good. But just do what you're good with, not what people want you to do.
Yeah, I'd just like to bring up another thing that I found really helpful, that I did way more with my second kid, is finding an exercise routine. Like if you can get into like a prenatal exercise routine, and that way you don't have to worry about if it's, if this exercise is safe for the baby or not. You can just follow their, exercises and everything. And yeah, it helps with a lot, like helps to get the baby in alignment, you get more energy. And it's also a great way to like start practicing like the breathing techniques and stuff. Like if you're doing like the hypnobirthing and stuff like that, when you're holding poses, you can like practice them. But yeah, definitely something I found helpful. And obviously like the Kegels or Kegels, however you say that, like your pelvic floor, kind of gets used and abused during pregnancy and childbirth. So it's really helpful to strengthen those muscles as well.
Yeah, I actually have something that I remember.
Suzanne?
Sorry, something that I use in my pregnancies, and I'd kind of forgotten about it, but I just remembered having a chiropractor, actually. I saw one throughout both my pregnancies, and I feel like that really kind of set me up well to kind of have everything nicely aligned. So yeah, that's something to share.
That sounds good. Yeah, I've actually noticed too. Yeah, just also Michelle, what you said, like, or oftentimes we just know when things that feel good, they are actually good. Like I was, for example, like I'm sitting on this gymnastic ball now, and I was instinctively doing things, just exercises that then I later on saw on YouTube are actually recommended, just before birth to get your baby in a good position. And I was just following whatever felt good. So I think your body really does tell you what is good right now, so you can listen to it. And if something feels bad, like if you're bending over or something and you have pain, then it's probably not the best thing to do right now. But I think it's a really good thing to get a bit of a feeling what your body needs.
Yeah, I would definitely agree with Brenda on the exercising too. I have been doing that this pregnancy, and I didn't really in the past, and I've noticed a big difference. Like I always got really bad sciatica. So like the last trimester, I just like got this terrible shooting pain, and I haven't really had that this time around, like knock on wood. But yeah, I think exercising that was really helpful. And then really quick, another thing that I've found really helpful is homeopathics. Like I know I did a show a while back on homeopathics. I'm kind of a nerd with it. But yeah, I've taken those as prenatals as well. And then for things that come up like heartburn or sciatica, I've taken, and they usually work, like not 100%, but it's really helpful, and it's natural. And yeah, if you can find the right one, it's pretty cool. And then they're also really helpful during birth as well. There's a lot of different things you can take, and it just helps with different stages of birth and with the overall experience. Like arnica is probably, I'm sure if you know about homeopathics, everyone knows arnica, but yeah, that one can be taken like all the way through birth and postpartum, and it just helps soften everything, and it helps with any kind of bruising or trauma or just in general, it's really good. So if you do one homeopathic, like arnica is awesome.
Yeah, I've also read, I don't know if you know Dr. Lewin, because he has a special diet before birth that you're supposed to start, I think, 4 weeks before. And I haven't been great about it, but I just reviewed the material. And so I guess the point of his diet is that you cut out sugar and carbohydrates just before giving birth, with the goal to keep your blood sugar levels at the same level, because it's the hormone prostaglandin is really important for a smooth and pain-free birth, because it's a natural painkiller, and the baby starts like getting that to your blood cycle about a month before birth. And insulin actually docks onto the same receptors as the prostaglandin, and so if you keep your blood sugar levels at the same, you'll have more of this hormone, and it's also helping your cervix dilate and all of these things, so it statistically leads to a much easier and smoother birth. So it's like, okay, I guess that's a good motivation about, yeah, skip that chocolate and have a bit of a more pain-free birth, maybe. So yeah,
Too
I
bad
don't know.
Lent's over. That would have been
I
convenient.
know. Like, yeah, motivation is gone.
That's hard to balance out with the dates in a way. It's like, because the dates are really high in sugar, but then you want to take them because they help your cervix.
That's a really good point. Actually, I was wondering about that too. And then I read up about it, and it said that the dates would still be fine in that amount because they're also really high in fiber. And so it said they can help with pregnancy-related constipation and everything. So I guess you shouldn't have bananas and mangoes and some of those really sweet fruits. But it did say the dates were still okay. So.
That's good to know.
Yeah.
So do you have any tips about the postpartum period, or anything we should pay attention to? Maybe something that's been taken wrongly in our culture in the last couple of decades, or
Oh, I'm passionate about the month. They like Eastern cultures, China and India, and the mum, after she just rests and bonds with her baby for the first 4 days. And there's a few other things to it. Like, you're only supposed to eat really warm foods that are like easy on the digestion. You're supposed to keep warm, so you're supposed to put socks on. And in some cultures, they don't even let the mum shower for like I think a while after birth because they don't want her to catch a chill. So I don't know about that one, but I think it's actually the rest of it is really fascinating because it's just focusing on like actually taking time to recover because it's like such a huge thing to give birth. I think in Western cultures they kind of just emphasize, you have to bounce back after you have a child and start exercising as can and clean the house and things like that. Whereas I think ideally the mum should just be taking it easy and just trying to focus on bonding with the baby, produce breast milk, and healing herself. So yeah, that's something I always try to focus on. I don't always do it perfect, but I'm going to try hard this time to do that.
Yeah, I'd like to add really quick. It's kind of amazing how the church gets it all right because I'm pretty sure that the presentation, so when Our Lady brought our Lord into the temple, it was 40 days after Christmas. So even back then, they would do that. She didn't leave home even to go to the temple for 40 days. And then after that 40 days, that's when you would like introduce your child and do like the baptism or whatever. So yeah, I just thought that was cool. I was like, oh, like that's how we're supposed to do it. We're supposed to wait 40 days and just like you were saying, but they even did it back then. So kind of cool.
It was so interesting. I didn't know that. That's awesome.
Do you have like
it's always like
do you have like any tips for moms to do something like that, especially if they have like other kids? Because I feel like it's really hard to take it easy if you have kids. I don't know.
Yeah, it's definitely hard. I think if you can get help, definitely use it. Like if you've got maybe like your mom or your in-law or someone there and they're offering to help, then definitely don't be afraid to ask for it. You can even get postpartum doulas. So it's definitely not in everyone's budget, but you can someone come and basically cook and keep the house clean for however long you really need them for. So that's pretty cool. I haven't used one of those.
That sounds amazing.
Like the idea of it, definitely.
I know a midwife once told me that you just should keep wearing your pajamas after birth so that your other kids kind of know, okay, mommy is not like healthy to get up, or she needs rest. That's kind of this like visual sign for them something is different. Mama needs to rest and stay in bed. So doesn't sound like too hard of a tip to do. So.
It's kind of nice when you have your babies during the summer because you can kind of just send your kids outside, and it's nice to just kind of lounge around in the sun and they can play in the pool, and you're there, but you're not like actively watching. Well, you're watching them, but it's not like you're playing with them, but you can just be outside, and that helps a lot because I don't know, being inside is hard when you have a lot of little kids and a newborn, but it helps to just send them outside. But
yeah. One thing I also wanted to ask Suzanne, because I think you also do online consultations. So if anyone wanted to book something with you, what would be the best way to reach you? And I know you're on social media, like I follow you on Instagram, you always have really good advice there.
Thank you. I would probably say my website is probably that's how you can book in if you want an appointment. So it's called New Life Naturopathy, www.newlifenaturopathy.com. So that's my website.
Awesome. I'll make sure we'll attach that in the show notes. Yeah, so I think this has really been fantastic content. It's been really great to talk with you, and we could probably go on for another 2 or 3 hours. But I know we all got somewhere to go with little kids. So I'd love to have you back on maybe sometime, and also to hear back from our listeners, maybe what were their experience, what's their best advice. I'm just going to see if any one of you has any last words to kind of wrap this up. And yeah, I think I'm going to give it first to you, Suzanne, and then Michelle and Brenda.
Just one other thing that I wanted to say was watch out for your thyroid during pregnancy and postpartum, because a lot of times that can be underdiagnosed because it's hooked up to just being part of like symptoms of pregnancy and postpartum. So just for women, try and make sure you can get your GP to give you a full thyroid panel when you're in your first trimester, an eye on your levels there, because honestly, like if you've ever had postpartum thyroiditis, it's horrible. It's like the most exhausting, and a lot of the time just it's just because you're a new mom, or it's you've had a baby, but it's a real thing, and it's definitely something that you want. So that's something. But otherwise, I just say, yeah, definitely if pregnant or you're wanting to have babies in the future, just read up on birth and know your rights when you go into birth, and realize, God gave you this body that can do amazing things, and it's fully capable of birthing a baby. So don't not trust yourself, and trust in God, and just read up on things, and just advocate for yourself, so you can have a good experience. So yeah, that's probably all I'd like to say.
Sounds great.
And that's hard to follow up on. I feel like you nailed it with all of that. But yeah, I would just definitely agree. Just embrace it, I guess. Like, and that's, I don't know, maybe kind of cheesy, but just, you were born to do this. You were born to, have babies and bring this wonderful little life into the world. And you can do it because that's what we were made to do. So yeah, just kind of embracing pregnancy and embracing birth is really important. Just don't think of it as a condition, think of it as you are the mother, and this is such an amazing gift to be able to bring life into the world. So yeah, I think that's all I got.
I would just like to say, like, at the end of the day, there's only so much you can control, and so it's like, do the best you can to have, like, prepare for the best birth you can. But I mean, birth can be unpredictable, so you kind of have to leave it in God's hands, and don't forget to like pray to like Saint Gerard and Saint Anne, and those patron saints that are really good for childbirth. So anyways, but I really like the idea of any listeners commenting and letting us know of any like tips that they have for childbirth, or anything that they would recommend not doing. I think we can always learn more about childbirth. So anyways, yeah, thanks for having me on.
Sounds great. Well, thanks you ladies so much for being on here, and until next time, and God bless.
Thank you.
God bless.